And for people who get scared after hearing about the diagnosis of heart failure, now you call it cardiac recovery, I think that's a great idea not to scare the people, but can they still live a full, active life, or they really have to cut down on things that they like to do? Just for someone who's listening, who's dealing with this, what's your kind of forecast for their future?
Yeah, they can absolutely. I want to emphasize though that not all types of cardiomyopathies are the same. So some are more severe than others, some require special attention. But in general, if it's because of ischemic heart disease, if you had coronary obstructive lesions, you had stents, you had a bypass surgery at some point, now your heart is weak, you have scar, it's not going to recover. Doing rehab, doing lifestyle stuff will really help you and live the quality of life that you want. Seeing your doctors, being on the four known proven therapies for heart failure with reduced ejection fraction, you can absolutely live a life of quality. Every case is going to be a little bit different, but the answer is yes. We live in a good time. We live in a better
Correct.
time than what we used to 10, 30 years ago.